Nursing for Rare Diseases, GNNRD, with 20 years of nursing experience across pediatrics, pediatric emergency, nurse education, leadership, service delivery, and project roles. She is committed to empowering nurses to provide exceptional care. Jasmyn holds a postgraduate qualification in pediatrics and nursing leadership and management, and has extensive expertise in program coordination, curriculum development, and international clinical training, mentorship, and building collaborative partnership both nationally and internationally. She is passionate about organizational culture, leadership, development, and advancing the nursing profession globally. Outside of her clinical role, Jasmyn enjoys exploring diverse cultures, learning from international healthcare systems, and pursuing nursing innovation and collaboration opportunities. Welcome, Dr. Jasmyn.
Wonderful. Thank you very much. So yes, my name is Jasmyn Coleman. I'm here representing the Rare Care Centre at Perth Children's Hospital, based in Western Australia, out of which one of our initiatives has been the Global Nursing Network for Rare Diseases. So where has this come from? The Rare Care Centre that we have in Perth, Western Australia, is quite an innovative, new cutting-edge centre. And whilst our nursing director was travelling the world and benchmarking internationally, exploring other rare disease centres and what is out there, what she realised and noticed quite consistently is that nurses were missing from the table when it came to this specialty. And so this initiative was inspired. Powered by the Rare Care Centre, based in Western Australia and co-founded in partnership with Curtin University in Singapore and the Sing Health Duke NUS Genomic Medicine Centre, the GNNRD, Global Nursing Network for Rare Diseases, was established in 2023. It's a growing, internationally recognised collaboration of nurses from countries across all continents, all united in their commitment to improving lives and outcomes for people living with rare or undiagnosed disease. Guided by its strategic framework and an active, globally representative committee structure, which incorporates lived experience, the network has launched an online platform, already commenced a suite of online free learning resources for nurses, and a webinar series, all tailored to meet the needs of a multilingual and global audience. Despite being such a new entity, the GNNRD is already being recognised internationally as a trusted partner and a credible voice in rare disease nursing. We've collaborated with leading organisations such as Rare Diseases International, the Wilhelm Foundation, and Medics for Rare Diseases in the UK on advocacy, education, and research initiatives. I'd like to share with you more regarding the development, the impact, and the future directions of the GNNRD, highlighting how a united nursing and midwifery voice can transform outcomes for people living with rare or undiagnosed disease. So rare disease has been identified by the World Health Organization as a global health priority. Whilst rare diseases are each alone by definition rare, collectively, there are over 7,000 known rare diseases affecting more than 300 million people worldwide. So whilst individually these diseases may be rare, collectively rare disease is quite common. They have a disproportionate effect on children, with 70% of rare diseases being identified in childhood and 6 out of 10 deaths in children actually being attributable to rare disease. The impact of disease rarity is significant on the individual and their family. Many of them will take a 5 to 7 year journey to reach a diagnosis. And once they do achieve that diagnosis, only 5% of rare diseases actually have a treatment available that has the potential to alter their prognosis. Rare and undiagnosed disease is actually the single largest cost to healthcare systems, costing 1.5 times the amount that every other condition combined costs. So that makes it clear why this is of such huge significance and why it is an evolving health priority. Majority of rare diseases are genetic in origin, and a majority affect multiple body systems. A lot of them are complex and have the tendency to be degenerative. We know that all people with this kind of medical complexity or chronic illness will experience a high care burden, fragmented care, and impacts on their entire family. However, people with rare or undiagnosed disease have additional challenges that are related to the rarity of their condition. We recognise some of these challenges to be common, irrespective of what the individual rare disease that they have is. Things like that protracted diagnostic journey I mentioned before, lack of available treatment options, low awareness of their condition amongst the health professionals that they interface with, increased mental health burden, stigma and isolation because they have a limited ability to connect with peer groups and organisations for support. So the GNNRD is a global nursing community of practice that encompasses all rare and undiagnosed disease. We call ourselves disease agnostic because we look at the commonalities of rare diseases rather than the specific diseases themselves. So why have we developed a nursing specific network? Nurses make up 50% of the world's healthcare workforce. As the largest and often the most accessible healthcare workforce, nurses are central to improving rare disease care. They support patients and families throughout the lifespan and are often the navigators of care and services for these patients. Whilst the role of nurses is diverse and varies from country to country, nurses permeate all levels of care from primary, acute, through to specialist roles. They also interface with research and clinical trials, and they tend to be the main caregivers in rare disease care. As part of their local communities, nurses are aware of its culture, its strengths, and its vulnerabilities, and are often the closest professional to the patient and their family. Therefore, they're in a brilliant position to advocate and be the voice of their patients. This is why nurses need to be supported, educated and strategically positioned in order to influence local, national and even global policy, advocacy platforms and play that leadership role. Okay. So the GNNRD's vision and mission were determined at the inaugural International Roundtable event that we held in Singapore, and are all about partnering with patients and families, ensuring that their voice is driving the right network activities. Our vision is to empower nurses globally to support and improve the lives of people living with rare and undiagnosed diseases. Our mission, to build capacity of nurses through leadership, knowledge and skills in partnership with people living with rare and undiagnosed disease. And these all underpinned by our principles of equitable access to care, cultural safety and responsiveness, and partnership with patients and families. We currently have 6 key objectives, which I'll expand on shortly when I expand on our strategic framework and the goals and initiatives that are being driven by that. You can see on this infographic what the GNNRD's overall goal is: to improve lives and outcomes for people living with rare and undiagnosed disease through the improved knowledge, awareness, and empowerment and impact of nurses. These goals are intended to create tangible outcomes, such as improved screening and diagnostic pathways, greater access to clinical trials, treatments and therapies, better care and support, and improved advocacy and system impact. Here you can see a rough timeline of the network to date. The GNNRD has only existed for just over 2 years, however, has grown and achieved incredibly during this time. It was founded in March 2023 out of that inaugural roundtable event held in Singapore. This event was attended by 33 nurses from across 25 different countries, ensuring that 50% of those countries were lower middle income for a diversity in economic background. We engaged with 8 global leaders in rare disease, as well as bringing 4 parents of children with rare diseases. And together, we co-designed the network. A second roundtable was then held in Abu Dhabi in 2024, which hosted 15 of our global nursing leaders, once again from countries of economic diversity. The meeting focused on developing the strategic framework. Along this journey, we've also had other exciting developments, including the launch of our nursing reference group, our Brazilian and Asia Pacific regional groups, the Education and Learning Committee, a Lived Experience Advisory Committee, and more recently, a Research and Innovation Committee. We held our first virtual symposium in 2024, and just now in October 2025, we have reached our next membership milestone. We now have over 750 members in the network. So here you can see an infographic of our strategic framework for the period 2024 to 2027, which we are midway through right now, launched after the second roundtable event that we held last year. It was informed by our vision, mission, and our principles, and has 6 strategic domains, each with goals and, importantly, the required actions to operationalise this framework into tangible and meaningful outcomes. I'm going to expand shortly on the activities that each of these domains are driving internationally. So as you can see, this network has gained a lot of momentum in a really short space of time, highlighting the need that there was and that there was really a gap in connecting rare disease nurses across the globe. In addition to our website and an online platform, we're also utilising social media channels to spread the word with a LinkedIn page and a YouTube channel. Our leadership members have presented at various conferences in different countries and also published several articles about the development and impact of the network so far. Engagement so far has been really effective. We have new members and new countries joining us every week. Currently, we have 761 members from across 65 countries, with every continent across the globe being represented in our membership. It's an amazing outcome in just 2 years for a fledgling organisation, and our membership continues to grow. Nursing students can also join, along with midwives and midwifery students, because rare diseases are so common that we know, regardless of their career, where they work, where their setting is, that nurses and midwives will interface with patients with rare disease. Ultimately, this is why we're here. We want to benefit people living with rare and undiagnosed disease. We know that there is a lack of knowledge out there amongst healthcare professionals, and we want to close that knowledge gap. We also know that that diagnostic odyssey is very real. Taking an average of 5 to 7 years to receive a diagnosis has a significant impact on patients and their families. We want to identify those children and adults with potential rare disease earlier and steer them onto effective diagnostic pathways. Only 5% of people with rare disease have access to a drug treatment that can actually alter their prognostic pathway, meaning the only chance of treatment or therapy is often through clinical trials. We need to be helping patients access these. We also know that people living with rare disease have high levels of mental health burden, along with stigma, isolation, and discrimination. We need to reduce this through raised awareness and advocacy. Which brings me now to the domains of our strategic framework and what are the actual, tangible, impactful things that we are doing as a network to make a difference. Domain 1 relates to education and learning. What we want to achieve is equitable access to evidence-based resources, a better educated nursing workforce to deliver quality of care, raised advocacy and awareness for rare and undiagnosed disease through education. But how are we going to achieve this, and what are we doing? We have an active and engaged Education and Learning Committee with global representation. This committee is contributing regularly to planning and resource development, with a position statement under development that will be made globally available. We have a resource hub on our website with a suite of growing open access and multilingual resources. We've recently collaborated with some other organisations to also create additional resources, such as with Medscape, recently creating 3 video resources. We've also partnered with Medics for Rare Diseases in the United Kingdom to develop a nursing-specific version of their Rare Diseases 101 module, which will be released in the next few months. We have a webinar series that is able to be viewed live by our members and integrates live translation technology to make it more globally accessible. We also then post all of our webinars on YouTube to make them globally available after the event. We have a comprehensive learning program under development, which, in keeping with our ethos of equitable access, once completed, will be free of cost for nurses to enrol in. And planning is underway for our first in-person symposium event, proposed to run next year in Sri Lanka. Domain 2 relates to leadership and advocacy. So what we want to achieve is developing, supporting and empowering nurses to lead excellence in practice for rare and undiagnosed disease. We want to drive recognition of this as a nursing specialty area, and we also want to promote advocacy for people living with rare disease. How we are actually acting to contribute to this: our online platform provides opportunities for international networking, sharing and conversations and connection between nurses. We've established regional groups with integrated leadership roles, and this includes a Brazilian group run by one of our leaders in Portuguese, overcoming that language barrier. Work is underway, developing a suite of resources to support GNNRD ambassadors in countries across the world. We ensure that there is recognition and awards for those members who do contribute to our committees, our roles and our activities, and have plans to implement a GNNRD mentorship program in the future. Domain 3 relates to policy and practice. What we want to achieve is promoting evidence-based nursing practice in rare and undiagnosed disease and using this to influence policy to improve lives and outcomes. What we are doing actively to achieve it: we are working to achieve it through the contributions of our GNNRD nursing leaders to committees, to outputs and to activities. By developing position papers and establishing the GNNRD as a credible network, we now have a growing platform to advocate and have real system impact. We have recently partnered with Rare Diseases International and the Wilhelm Foundation on a project to develop evidence-based care pathways for both rare disease and undiagnosed disease. Domain 4 relates to research and innovation. So what we want to achieve here is identifying, supporting and contributing to priority-driven research and innovation. We want to also promote and design research that actively incorporates lived experience. In recent months, we have launched our GNNRD's Research and Innovation Committee, who are already drafting a position statement and scoping for research priorities. Their currently identified priority is in the domain of rare disease nursing roles and scope of practice to drive specialty positions. Domain 5 relates to collaboration and partnerships. We want to see effective and collaborative global partnerships with the GNNRD, and to ensure the voice of IUD lived experience is embedded in all of our GNNRD activities. We have established a lived experience advisory group, which is comprised of rare disease patients and parents from across the globe. We take our education resources, our research activities and other initiatives to this group for input, ensuring that the patient's voice is at the centre of everything that we do. As I mentioned previously, we are already partnering with well-established organisations to collaborate on research and innovations. However, we're always looking for new opportunities to connect and to contribute. We have a clear organisational structure, frameworks and documentation to drive our partnerships, to ensure that they are strategic, transparent and that they are mutually beneficial. Our final 6th domain relates to growth and sustainability. We know that in order to exist and to keep relevant, we need to be an effective, agile and sustainable organisation, and we need to continually foster an active, visible and engaged membership. We've recently achieved 10 years worth of base funding to know that we've got the surety to be able to continue the core work of this organisation, and are in the process of establishing the GNNRD as a not-for-profit entity, which will enable it to more effectively deliver on its outputs. We have a clear and an adaptive engagement strategy, ensuring we use a range of methods to engage and meet the needs of our members, remaining contemporary, effective and dynamic for a global audience. So what can you do? We are asking all nurses to consider how they can get involved. We are asking all health professionals and health organisations to consider how they can partner. There are several ways that they can do so. First of all, if you are a nurse or a midwife or a student, we invite everybody to join the network because, as I said earlier, every nurse will come across patients with rare disease, irrespective of where they are working and what specialty they work in. We ask for people to share the network with other nurses and midwives and share this important message. We'd like you to reach out and engage if you can see opportunities to partner with us on rare disease. And also, please explore our website and our suite of freely accessible resources to expand your own knowledge or see where they may be applicable in your own organisation. So here you can see the link to our website, which is gnnrd.org. If you'd like to know more. The first QR code we have displayed will take you to that website where nurses or midwives or students can sign up to the network, but everybody can see our free open access suite of resources because we want things to be freely available. The second QR is for our LinkedIn profile, which is a fantastic way for non-nurses or other organisations to be able to connect with us and follow the GNNRD's activities. Thank you very much.
Thank you very much. I now take immense pleasure of inviting Rosny Tujari to facilitate the speaker note certificate to Dr. Jasmyn.
Thank you.
Would love to have the conversation with you.
Yeah, wonderful.